Welcome back, guys. It's 2019 and it's a new year here at Bloomsburg Veterinary Hospital, and we have another edition of some informative videos for you. People ask me all the time, why is dental health important? Really, do I really have to brush my dog's teeth? Is this really important? Yes, it is. The mouth and the teeth are very much connected with the rest of your pet's body, just like us. If you have a sore, bacteria-filled, uncomfortable mouth, not only do you feel sick, but it also makes you grumpy and uncomfortable, and it can cause other problems in the body, like bacteria going around in the bloodstream, affecting other organs, affecting the heart. And of course, our goal is we want our pets to be happy and healthy, and when they have a rotten, uncomfortable mouth, they're not happy. I think the first question people always ask is, when we recommend dental procedures, what does that even mean? Typically with dental procedures, unfortunately, unlike us, dogs and cats don't know when they need to spit or swallow, or to keep their mouth open, or not to bite us when we're doing work. So we do have to put them under anesthesia. So once they're nice and asleep, we thoroughly clean their teeth. So we take the little dental scaler, just like at the dentist, and we clean all the yucky tartar off their teeth. So, we have a dog here or a dog mouth that has lots of yucky tartar. We clean it off and hopefully give them a nice white smile. From there, we take x-rays. So just like when you go to the dentist and you bite the little plate and they look underneath the bone and underneath the skin, we do the same, because just because it looks good on the outside doesn't mean it's good on the inside. Bacteria crawl up underneath the gums and can destroy bone. So we want to look for things like that, so we can either treat it now, or sometimes we even have to remove teeth. So we take full mouth x-rays, we go all around the mouth, every tooth, and we take pictures. So once we have our full set of x-rays, then that's where I come in and I do my probing. So just like the dentist does, I go from one tooth to the next and use my nifty probe, and I go around each tooth and I search for pockets. So pockets can indicate bone loss or destruction of the tooth. So I go around and check everything. While I'm in their mouth, I'm also checking all of the soft tissue structures. I'm looking around the tongue, looking on the cheeks, looking on the roof of the mouth, looking for ulcers or tumors or changes that could be causing pain or playing a role in their dental disease. Once that's all done, we actually call you. We like to make sure that our clients are up to date on everything we're doing and playing an active role in decision making for their pets. I never ever want to send one of your pets home with no teeth and have it be the worst surprise ever when you come to pick them up. So we stop what we're doing while your pet is under anesthesia and we call you and we talk about the plan. That way you know what's best for your pet. You have an opportunity to ask questions why we're doing or recommending what we're doing. And of course, we want to know how much all this is going to cost, and we'll get to that later. Once you give the okay, or we come up with a plan together, I get to work. Sometimes there's no work involved, in that we polish the teeth. So we use, fluoride and polish, and we make them shiny and white, and we can wake up your pet. Sometimes we have to do surgery, meaning that we actually cut through the gums, remove some bone, and we have to manually remove the teeth. So it's a process and it can take some time. That's another big question that people ask is, how long is this procedure? Dental procedures are one of the longest procedures that we do here in the hospital. They can range anywhere from about an hour and a half to 2 hours up to 4+ hours, depending upon how much work we have to do. So it's a big commitment and a big endeavor, but we're working our butts off during these procedures. Next common question that people always want to know is, do you really have to put my pet under anesthesia? There are some veterinarians and some clinics that offer procedures without anesthesia. really that's probably not the best thing for your pet. They don't know why we're doing what we're doing, and it can be painful, especially if they have dental disease. We also want to protect their airway. When we're in there, we're using a lot of water, we're cleaning a lot of things. There is blood, so we want to protect their airway so they don't choke or they don't get any of that fluid down into their lungs and cause aspiration or cause pneumonia. So it's really for their protection why we do that, and so we can do the best thorough job for you. Just scraping tartar off the teeth with your thumbnail or with a tool while they're awake is not addressing the bacteria underneath the gum line. So that's a very important thing to make sure that they're safe and that we can do the best job for you. People, along with anesthesia, say, well, isn't this risky to my pet? And that's why we always have a conversation with you as a veterinarian to say, what are the risk factors for your pet specifically? If you have an older pet, I always say age is not a disease. I have done dental procedures on 18-year-old cats, and it helps to significantly improve the quality of their life. I'm not saying every 18-year-old cat needs to have a dental procedure where it's safe. That's why we do what we do to look at your pet and assess what's best for them. We also always perform blood work prior to putting your pets under anesthesia. We do that because we want to make sure we're not stressing out their organs and we're doing what's best for them. There have been many procedures that we end up delaying because we've discovered things that were never even known to be happening before. So we are not of the mindset to just do things and worry about the effects later. We want to be proactive for your pet. So yes, anesthesia can be risky. It can be risky for any age, any animal. With dental procedures, usually we're doing this because there's a potential medical issue or how dental disease affects their quality of life. So that's something that with your individual vet will decide whether anesthesia is too risky for the procedure or not. Another thing that people always have concerns about is the idea of extractions. Do we really have to take out their teeth? And when we do, how are they going to live their normal life? With extractions, again, remember, we're removing teeth that are diseased and actually have a problem. We're never removing healthy teeth. Think about if you've ever had a toothache, how painful it is to chew, or if you accidentally bite something that you get that zing of pain, or how miserable you are when your mouth is swollen. Your pet feels like that all the time when they have dental disease. By removing those diseased teeth, we're relieving pain and we're taking away infection. 99% of the time, clients call me up or I see them 2 weeks later after the procedure and they tell me how incredibly happy and energetic their pets are and how darn hungry they are, that now it's not painful for them to eat. So even animals where we remove most of their teeth or all of their teeth end up feeling so much better afterwards because we're getting rid of that pain and discomfort. So it's scary to think about. We all worry about, will my pet return to their regular habits? They will. And I think they're going to feel even better with those extractions. Finally, the big elephant in the room, cost. Why are dental procedures so darn expensive? One is, like I mentioned earlier, dental procedures are some of the longest procedures that we do here in the hospital, and they are under general anesthesia. So it's a big endeavor. It isn't a 10 or 15 minute neuter procedure. It is a 2 to 4 hour or more endeavor. People often don't realize that we are actually performing surgery. So outside of the thorough cleaning, the probing, the full dental x-rays, if I have to do surgical work, it is surgery, where I'm using tools, I am cutting into tissue and cutting into bone. It isn't, we tie a piece of dental floss around their tooth and tie it to the doorknob and slam the door. There's a lot more sophistication to it. So it takes skill, it takes practice. Not only do I have to learn in school, but I've had to take multiple classes afterwards through my career so I can do the best procedure possible. So it takes work. And when we do the best thing that we can for you,
unfortunately, it can add up.